So what's a typical CMO day, or what was it for me? And it was somewhere between these two signs, and generally to the left and not to the right. When I first had become a chief medical officer, I was reporting to the chief executive officer, who had been the chief medical officer until he was elevated to the corner office. And after I had been doing it for a few months, he said to me at one of our weekly meetings, "How's it going so far?" And I said, "Well, I love it. I love it because it satisfies my desire for a multitude of different things." But I had to tell him that every morning after I worked out and I showered, while I was in the shower, I thought, what are two things that I absolutely have to get done today? What are those two most important things? And that thus far, to that point in time, now months into the job, I had never gotten to even start number two, because something came up as I was dealing with number one. And I loved that. If that's not your idea of fun, you may not want to be a chief medical officer. So you just need to think about that. So to tell you what my situation was like, a large employed group of physicians and advanced practice clinicians reported to me. When I left the position in 2021, we had 2,000 in our employed group. And obviously, if you have that large of an employed group, you're always going to have a few people that you may have to deal with on a one-on-one level for either clinical issues or even somewhat more of a demand upon your time, personal interaction issues. And they can be difficult, but they require your attention. And occasionally you have to separate some of those people for either quality issues or for their not being cut out to be a team player. Medical staff affairs reported up to me, which was key in terms of the credentialing activities of getting people onto the staff. All of education reported to me. So not just graduate medical education, which was my passion over my career, but undergraduate medical education. Lehigh Valley Health Network was a clinical campus for the University of South Florida School of Medicine, the Morsani College of Medicine. And so that reported, but also nursing education, education of the staff, that all reported up to me. Research at our health network was exclusively clinical research. There was no basic bench research. And most large health networks that aren't a part of a medical school have that same type of research. But there are quite a few demands that have to be very fastidiously followed in terms of being clear that the research is being conducted in an effective fashion and that the reporting requirements are being met. Quality and patient safety across the entire health network, both in the ambulatory environment and the inpatient environment, reported up. I already talked about clinical documentation improvement. The chief medical information officer, the one who was clearly most involved with analytics and with our electronic health record, we were an epic shop at Lehigh Valley Health Network, reported up. Each of the department chairs reported to me, and we remained largely a unified departmental structure. By that I mean there was a department of surgery, but not a department of orthopedics, otolaryngology, etc. And so there were fewer department chairs, which made it somewhat easier to deal with. And then at each of the hospitals, there was a hospital chief medical officer that reported up to me.